I'm going to be testing cranial nerve 1. So I'm going to have you close your eyes, occlude your right nostril, and smell. And what do you smell?
Coffee.
Good. And now you're going to occlude your left nostril and smell. And what do you smell there?
Coffee.
All right, you can open your eyes. Did both sides smell about the same? And one wasn't stronger than the other?
No.
Okay. So an abnormal response would have been if one side was stronger than the other, or if she couldn't smell at all. Okay, I'm going to be testing Liz's cranial nerve 2. And first thing we'll have you do is cover your left eye and read the lowest line up there that you can read.
TZVECL.
Good. And now you're going to cover your right eye and do the same thing.
TZVECL.
And then with both eyes.
TZVECL.
Okay, so that's a normal response. She's reading the 20/20 line. If she couldn't get the 20/20 line after having her best correction on, then that would be an issue. The next thing I want to do is test her side vision. So I'm going to have you cover your left eye again, and you're going to be looking at my open eye. And while looking at my open eye, tell me how many fingers.
1, 2, 5, 1,
And now I want you to add up the fingers I'm holding up.
3,
And
6,
good. And now you're going to switch eyes. And this time you're going to look at this eye. Same thing. Just tell me how many fingers.
2, 1, 1, 2,
And now add them up.
2,
And
3.
Alright, so she was full to finger count, which is normal. If she was unable to see any of those fingers that's holding up in either of those quadrants, that would be an abnormal response. The next thing I want to test is color vision. So I'm going to have you cover your left eye again. And then, what color is this cat?
It's red.
And let's say that you would pay $100 for that red cat. Alright, I want you to switch eyes. Would you still pay $100 for that red cat? Is it about the same brightness and
Yes.
color as the other one? Okay. So that's normal, so normal color vision result. And if she would have said that she would have paid more than $10 on one side, or less, or $10 less, more than $10 less on the other, that would be an abnormal response. Okay, now I'm going to be testing Liz's pupils and making sure that they react the way they should to light. And so I'm going to have you just look right out there. And I'm shining the light in her eye, looking for constriction. Constriction in the right eye, also constriction in the left. Now shining in the left, constriction in the left, and pupil constriction in the right. And now testing for an APD, just keep looking out there. And the pupils are staying constricted as they should. They're also equally round. So that's what we want. And if it was abnormal, one eye may have constricted more than the other, or not constricted at all. And now I'm going to be looking at her nerve and macula directly. So go ahead and just look up the ceiling a little bit. Do your left eye first. And looking at the nerve, it is pink, round, and distinct. And then the macula is flat and intact. That's on the left eye. Keep looking up there. And this nerve is also pink, round, and distinct. And the macula is flat and intact. A nerve that is not flattened or not pink, round, and distinct, or maybe edematous, would be an abnormal result. And then also a swollen macula, or one that's just not flat and intact. Okay, I'm going to be testing cranial nerves 3, 4, and 6. And the first thing I'm going to do is be testing the extraocular muscles. So I'm going to have you follow this light with your eyes. And tell me if you have any pain or double vision while we're doing it. Any pain or double vision?
No.
And no pain or double vision. Alright, so that's a normal response. An abnormal response is if there was pain, double vision, nystagmus, or if the eyes moved asymmetrically. So she had full range of motion OU. And the next thing I want to do is just test your convergence. So I'm going to have you look at my finger and just keep looking at my fingers. I'm moving in. And good. And she was able to converge all the way to the nose. That's a normal response. If she wasn't, or if one eye would have moved in and the other one didn't, then that would have been an abnormal response. Sure that her pupils are equally round and reactive to light, and that she is responding to light and near with her pupils. So first thing I want to do is just have you look out there, and we'll measure the pupils, and they are equal, and well, they're the same size in the dim. And now I want to do it with the light. Keep looking out there. And they're the same, they constricted the same amount in the light.
Go for it.
Alright, now just gonna make sure that, she's reacting to light, which we already did, but she is. And now, gonna make sure that she has a near response, so I want you to look at the E on the stick. Now look out there at the wall, and back to the E. And she is constricting to near, so she has a response to near. Okay, now I'm gonna be testing both the motor and sensory components of the trigeminal nerve. So I'm gonna have Liz clench her teeth and keep clenching. And I'm just feeling the contraction of the masseter and temporalis muscle, and they contracted about the same. An abnormal response would be if they didn't contract the same or didn't contract at all. And then next I'm gonna do the sensory component. I'm gonna have you close your eyes and tell me there, did those feel about the same?
Mm-hmm.
And now here, did those feel about the same?
Yes.
And then, did those feel about the same?
Mm-hmm.
Okay, so an abnormal response there would be if she didn't feel it at all, or if one side was more sensitive than the other. And the next thing I'm gonna do is test her corneal reflex, and I'm gonna do that using the cotton whiz test. So just look out there straight, and I want you to tell me whenever you feel this. Did you feel it?
Mhm.
Okay, and then same thing, look out there and tell me whenever you feel it. And she displayed bilateral blinking on whenever I touched both her left and right corneas, which is normal. Abnormal would be if she didn't blink, indicating that she didn't feel it on one side or both. So that's all. I'm now testing Liz's facial nerve by testing some of the facial muscles. And the first thing I want to have her do is raise your eyebrows. Good. And now frown. Now I want you to close both your eyes really tight. And now I want to try to open them. Good. I can't get them open. And now I want you to smile. And now I want you to puff out your cheeks. And I want to try to make her expel air. Okay, it didn't work. So all her muscles seem to be symmetric, and they don't seem to be weak. So if they were, then that would be an abnormal response. Now I'm testing Liz's acoustic nerve, and I'm going to occlude one of her ears, and I want you to tell me whenever you first hear a noise.
No.
All right, good. And now I'm going to do the opposite side and tell me whenever you can first hear a noise.
No.
Okay, so those responses were about equal. The distances were about equal on both sides. An abnormal response is if the distances weren't equal or she could not hear at all. Now I'm going to be testing Liz's cranial nerves 9 and 10, and the first thing I want to have you do is say, I love neuro.
I love neuro.
All right, so I'm just listening to the patient's voice to make sure that it's normal. There's no abnormalities that I detected. Now, just going to ask, do you have any difficulty swallowing?
No.
Okay, an abnormal response is if someone did have a difficulty swallowing. And then I want you to say ah, like stick your tongue out and say ah. Right now I'm looking at her. All right, good. I'm looking at her soft palate to make sure that it elevated and that her uvula remained in the midline, and it did. And if it didn't, then that would have been an abnormal response. And then now I'm going to test her gag reflex. Not really, but go ahead and open your mouth. And I would stick something like this back there and tickle the back of her throat and see if she had a gag reflex. And if she did, that's normal. And if she didn't, that's abnormal. Okay, now I'm testing Liz's spinal accessory nerve. The first thing I want to have you do is like shrug your shoulders. Good. And now I want you to do that against my hands. Good. And now look to your right. Look to your left. And now you're going to look to your right again. Good. Push against my hand. Push against my hand. Good. And so she was able to raise her shoulders equally on both sides. The resistance to my hands were equal with her shoulders and her face. So that's a normal response. If those were unequal, that would be abnormal. Okay, now I'm testing Liz's hypoglossal nerve. And the first thing that we would normally do is make sure that the patient had normal articulation, which we have previously tested. So now I'm going to have you open your mouth and put your tongue on the floor of your mouth, and I'm just looking for any abnormalities or atrophy or asymmetries in the tongue, and it looks normal. Go ahead and stick it out just a little bit. And now I'm still just looking to see if the tongue has deviated from the midline, and it hasn't, and you can put your tongue back in your mouth. Now I want you to put your tongue against your cheek here. Good. And apply pressure over here as well. Okay, and the pressure on each side was equal. If it wasn't, then that would be an abnormal response, or if she wasn't able to do it at all.